So good afternoon, everyone. So thank you for joining us for the afternoon session on COVID-19, physical and mental well-being. We have for this afternoon three papers. We have contributions by Urszula Wolski, Michael Mutz, and Peggy Schyns. Unfortunately, the fourth presentation by Lina Martínez had to be cancelled. Unfortunately, she had other obligations. So I'm going to make Urszula Wolski our first presenter panelist, and then we can start. So for questions after the presentation, again, you can use the chat box or you can raise your hand and I will give you the platform. Hi, Urszula.
I'm muting myself and sharing my video, so hopefully you can hear and see me, everybody.
Yes, we can see you.
Good. Okay. So hope everybody is safe and well during these times. So thank you for having me. Okay. So we'll now share my screen, and hopefully everything will work. There's my PowerPoint. And let's run the PowerPoint.
Yes, it's we can see your screen.
Yep. Is the PowerPoint running though? No. I want to run the slideshow.
Yeah, you can run.
There we go. Okay, just a little bit slow.
Perfect.
Okay, so yeah, so the aims of my research, which is currently ongoing, is looking at adults' physical activity and well-being during lockdown. So I was interested to find out whether and what ways adults continued with physical activity. So what did they do? Were they able to continue with what they did before lockdown? Did they turn to online classes? Were they doing more kind of home activities? So did they increase or decrease their levels of activity? And then as a result of this, what was their impact on happiness and well-being? So using a mixed methods approach, currently have a questionnaire that is still running. A plea, if I may, to people to fill out my questionnaire and share it as well. There's a link there. And I can share that link in the chat box later if that's okay, if I'm permitted to do so. So it is a kind of a snowball sample using social media, using LinkedIn, Facebook and Twitter in order to share my questionnaire. So to date, I have 146 responses. So I am looking to increase that. And I've also just started a couple of interviews. So today I'll only present some of my questionnaire findings, and then at a later date, when I put all the research together, I will have interviews as well. Okay, so a little bit of background. So as probably all familiar to everybody by now, a global pandemic was declared by the World Health Organization on the 11th of March of this year. So many countries experienced complete or partial lockdowns. And then I looked at the WHO website a couple of days ago now. So according to them, 216 countries, areas or territories have been affected. So what is important during this time then is to maintain our physical activity, no matter how small that is. It is important for not only our physical, but also our mental health as well. So there's various kinds of definitions about what this should involve. So according to Public Health England, this should involve participating in more than 30 minutes of moderate intensity of physical activity per week. So anything less than this is considered to be inactive. So what is meant by moderate is where your heart rate and your breathing is slightly elevated. In fact, doing presentation actually is elevating my heart rate right now. So the NHS then, so the National Health Service in England, advises 150 minutes of moderate intensity activity a week. And so this can be broken down over to 1 to 3 times a week. Others will argue that it's even if you do it as much as 10, 15, 20 minutes a day is enough. And then the WHO, which I think, looking at a variety of studies across the world, most people use the WHO, World Health Organization guidelines, and advises that at least 150 minutes of moderate intensity physical activity or 75 minutes of vigorous intensity physical activity per week, or a combination of both. Okay, so doing this under lockdown can be difficult, particularly for those countries that are in complete lockdown. So closing of gyms, sports and leisure centres, even public parks, therefore leads to restrictions in activities, making it difficult to take part in anything. And even more so for those that had to shield, so those not being able to go out at all. Okay, so what impact would this have then on both physical and mental health? So I've looked at a couple of reports. So first of all, a big report done by Sport England, which started, first of all, weekly reports between the 3rd of April and the 25th of May, and then after that, monthly reports. So the last one for August hasn't been released yet, but I will as part of my work, look at some of this detail. So the sample was 2,000 of adults aged 16 and over in England for each wave of the report. So what they found out in their first week is that actually 31% of adults did more, compared to 41% of adults that did less of physical activity compared to before lockdown. Quite a large proportion, so 62% of adults thought it was important to be active during the outbreak, and 69% of adults agreed that exercise is helping them manage their physical health, and 65% thought it was helping them to manage their mental health. Activities that were seen as very popular and something that was increased over the coming months was things like walking, so 59%, an increase in online fitness, so 44%, and jogging and cycling. So again, I think with walking, jogging and cycling, these were outdoor activities that people could still do. So in England, under lockdown, early lockdown, we were allowed to go out once a day for about an hour initially, and then that was extended. So people also accessing online classes. But this is different between the different demographics of the population. So for older people, so particularly older people aged 70 and over were told that they should be shielding, particularly if they had any underlying health problems. But also people on low incomes, living alone or in urban areas. So, you know, in big cities, it's harder to go out and avoid people as opposed to rural country areas, and also those shielding or self-isolating. All these groups finding it difficult to exercise. It was also found by Sport England that there was a gender difference, with more males exercising. And these were the trends that continued throughout their reporting. Changes did start to emerge as lockdown restrictions started to ease. As we were allowed to go out more, there was a decline in online exercise as well as home-based activity. So certain activities such as walking, running and jogging were increased. So as well as the ease down in lockdown restrictions, people, I suppose initially during early lockdown, people worried about going out, but as time went on, they were less concerned about going out, started getting used to going out. And also at that time in England, we had good weather, which is, you know, highly unusual. So 26 of those who exercised online cited Joe Wicks as the most useful instructor or influencer. So again, people continued with certain activities, and part of the report found that actually they wanted to continue with these activities as lockdown eased, or when we started to come out of lockdown. And activities that were missed the most were things like going to the gym, swimming, and some people have said walking as well, that they would look forward to doing. Okay, so as we started to come out of lockdown, when places started to open, people started to return back to work, shops were opening, so non-essential shops allowed to open. 60% of people said that they would like to continue with being as active as they were during lockdown. 62% intended to carry on walking and cycling for their everyday journeys. However, 32% thought that coming out of lockdown will make it harder to be active. So in England, on the 25th of July, gyms, pools and leisure centres were able to reopen, however with some restrictions, so restricting the numbers that could attend, running small classes. So people have started to return to these facilities, but slowly and in slow numbers. And then the activities that were seen to increase during lockdown, such as walking, cycling and running, have fallen. So I thought it'd also be interesting to look at reports from other countries as a by way of comparison. So Belgium, which was seen to be in a lockdown light situation, so perhaps not too different to England, in that they were allowed to go out with either members of their household or a friend, which is good if you live alone, so to deal with issues of isolation. And so the main reports was that those already highly active before, and I find this really interesting actually. So those that were highly active before, those that were over 55, on low education, or used to exercising with friends or in a sports club, so that social element. Also perhaps those that weren't using online tools to exercise, self-reported to actually exercise less during the lockdown, as opposed to those who weren't as active before. So having less time, sitting more, missing the familiar way and competitive element of exercising were seen as the main reasons for a reduction in exercise. And so although I'll only talk about a couple of reports that I've seen from other countries here, I have looked at other reports and there are similarities. A second one that I picked up on and we'll discuss is a report by Chin and others. Apologies if I haven't said that correctly. And so what occurred here, so obviously lockdown occurred earlier in China, where the epidemic started, and so they had complete lockdown in some cities. And here there was seen as to be a significant difference in physical activity. So 60% did not engage in suitable physical activity, and actually found the report found that screen time was exceeding more than 4 hours per day, which was a lot of screen time. But what was also found is that individuals engaging in physical activity had better emotional states. Okay, so this is in vigorous activity, but for light and physical activity, they found that the opposite was to be true. Okay, so going on to my own research and my findings to date. So just to give you a bit of an overview of what the demographics are to date. A majority are female. Respondents come from a range of age groups, and most are married or single. And something that I do want to increase is the non-UK respondents and respondents from different ethnic groups as well. So that's probably going to try and increase respondents for that. A question that I asked, I thought would be useful because I guess again, similar to other countries, with schools being closed, you know, people who were working from home also had to homeschool their children. So again, this is a factor that would leave little time for exercising. And this was one of the findings that I came across, that some people had said that they didn't have time for exercise because they were trying to work and homeschool at the same time. But there are also reports of more family time, and therefore doing physical exercise together as a family. Okay, so what did physical activity look like before lockdown? Okay, so majority of people that answered the question said that they would walk for leisure or to and from work. And I decided to use to give them a specific time, thinking that 20 minutes each way would be adequate. You know, 5 minutes isn't really long enough. So I gave them a specific timing. So most people would walk or cycle, but also quite a number of people went to the gym or went swimming. Okay, so both of those activities were shut to people during lockdown. And also a large number of people belong to a sports club or leisure centre. So what did physical activity look like under lockdown? Okay, so as I mentioned earlier, some countries, such as here in the UK, in England, during early lockdown, we were permitted to go outside for some form of exercise once per day. And early on, that was restricted to an hour. So first chart tells us that most people, so 40% went out on a daily basis. And then, 15.8% went out 3 to 4 times a week, and 14% once or twice a week. So majority of people did at least go out for some of that. But what is important to highlight here is about 20% did not go out. So what were some of the reasons for not going out? So 14% said that they were shielding, 7% said that they were self-isolating for 14 days. So this would have been during early lockdown. And quite a significant number of people said they didn't want to, so 32% said they didn't want to risk going out. So even though they didn't have to shield or were self-isolating, they chose not to go out because they didn't want to risk it. And then people found that actually they could exercise at home in the garden for those of you that, for those people that had gardens. And a number of people, so about a quarter of respondents said, 25% said that they were too busy working or homeschooling to participate in any kind of physical activity. I also asked the question then what kind, if they were able to continue with their physical activity or if they did something different. So 47% said that they were able to continue with their usual activity, and 44% that, well, they did something but some other activity. And so the other activities that they did were walking, cycling, and home workouts, which relates back to the report by Sport England. But also I found that participants engaged in gardening as well. So again, that's something that you could do if you have a garden or an allotment. And then 45% participated in online classes. And so again, what was specified by participants is the Joe Wicks workout, yoga, various YouTube workouts, and live gym classes. So some gyms were able to offer online classes to their members. Okay, so 46 people responded saying to not doing any kind of regular physical activity during lockdown, and quite a large proportion of people, so 63%, said that this was due to lack of motivation, or 48% said this was because their activities weren't available, you can access them. And again, a large proportion of people stated lack of time or having to work from home or homeschooling. And a few people said that, so 11% said that they didn't exercise before. And also a few people specifying that they were a key worker. So being a key worker, so whether you're a nurse, for example, then you would just continue working. And a small amount of people were shielding. Okay, so I also asked then participants to rate, first of all, their happiness level before lockdown. Okay, so use the scale of 1 to 10, where 1 is low and 10 is high. And you can see that majority of people tended to score quite highly. I also asked them then how they would rate their happiness level during lockdown. And then although majority of people still scored quite highly, this was actually quite spread out over the scale. So also a number of people scoring quite low. And then finally ask them to rate their overall being right now. Okay, so with doing an online questionnaire, I do have a time stamp. So then when I come to do further analysis, I could look at the relationship of what they scored at the time that they filled in the questionnaire and where England was in during lockdown or whatever country they came from. Okay, so finally then, I thought I would just present to you some of the further comments, so share with you some of the further comments that people left in the questionnaire. So I left this as an open-ended question. So people, so for example, and quite a few people said this, that well, actually not having to commute to work has actually left me less tired and giving me more time for exercise. A few people talked about having more time as a family and doing physical activity together as a family, and was seen as something positive for the relationships. So somebody said that, well, they thought that exercise could be easily done. It's something that you can do on your own, even during these difficult times. So this person said, I really enjoyed cycling on car-free roads. I wouldn't dream of cycling on in normal times. So even just half an hour can be enough. So quite a few people actually reported doing more exercise during lockdown. So this person said, I've done more during lockdown than I have for years. Cycling, or I think that's meant to be walking every day, and if it's bad weather, I have a cross trainer in the garage. Again, so a few people mentioned doing gardening during lockdown. Being able to go to your allotment was permitted during early lockdown. And then somebody else has said, I use the 1 hour of being outdoors to work every day. Would normally not walk as much as this. And I'm still doing it every day and often go longer and really enjoy doing it. So I use my normal commute time and will miss it when I have to travel again. Again, a couple of people have said that, so in relation to commuting. And somebody actually absolutely loved being in lockdown. For them, it slowed the pace of life, gave me the opportunity to have my little man home with me. So referring to the son. So being able to create fun ways to keep active during lockdown that included him. It was great fun, and I only wish I had the time to keep up with the walking once normality resumes. So my husband has started running again. Okay, so quite a positive effect on people. Okay, so also some not so positive comments. So one respondent said, I found I had bags of motivation to exercise in the first couple of months of lockdown, but I've really struggled to keep that going the longer lockdown goes down. And although I haven't mentioned it in the report, the report done by Sport England did actually, I think, can't remember, maybe about 4 or 5 weeks in of reporting that people, there was a drop in motivation of exercises as lockdown went on. And I think that changed again as restrictions were starting to be lifted. Again, so here not having time to exercise because of looking after children. And I think this has come up a few times, and I've read this in other reports as well, is putting on lockdown weight. So perhaps maybe being physically active, but also eating more. Okay, and this person reports that family time is keeping me going, but the lack of routine and getting out regularly is impacting on my motivation to exercise. So it's now becoming too easy to stay at home. Okay, and then this participant says, well, while I continue to exercise in lockdown, it was probably about 50% less than what I was doing before. So time and space restrictions have prevented me from doing as much, and I think this has contributed to my lower mood. And then finally, again, so a respondent from Iceland said, well, it took me a few weeks to get moving as often as I used to before COVID. Okay, so in summary, I think having looked at the various reports, and although due to time limitations of this presentation, I've not been able to talk as much about that, but there is generally a difference in opinion over how much exercise and level of intensity. So perhaps even going out for a short walk of perhaps 20-30 minutes is just enough to improve physical and mental well-being. I think it does very much depend on what the person's used to doing. So again, this could tie in with to the report done in China that I talked about earlier, is how much people did before lockdown. So in a way, perhaps a positive can come out of a negative. It is a global pandemic, but people being forced to slow down, realizing that the time that they have is invaluable, spending more time with family, and then taking opportunities to do things that include exercise, perhaps to continue with different types of activities. So findings to date suggest, and this is also coming from my report, is that most people were able to do some form of physical activity. So in early lockdown, this was more home-based, with a mix of just creating own workouts or doing online classes. But as lockdown eased, there was an increase in participation. And then as we came out, so as England came out of lockdown, then that participation has dropped as people return back to work. For those that were participating or less though, then this could reasons for this were because they were working from home, or they were a key worker, having to homeschool, so little time available for physical activity, or they were shielding or self-isolating. Okay, so some references and contact information if you'd like to get in touch. Happy to connect. So finally, just to say thank you for listening. Any questions?
Many thanks for your very interesting presentation. Are there any questions for Ursula? You can either raise your hand or put a question in the chat box. Anyone? Michael, I will give the platform to you.
Yes, thank you for your presentation. I was just thinking, and you had this on your last slide. If people change sports activities in gyms or in sports clubs and go for a short walk, how does this impact on their well-being or on their health status? And in particular, if they, let's say, do some work in the gardening work or something like that, can you say something about that? If there are differential effects on?
Yeah, if I think I'm understanding you correctly, I think sort of based on what a data I've gathered so far is for those people that were used to going to the gym, so doing activities that you can't necessarily easily do at home because you don't have the equipment, may initially have found it a bit difficult to do other things. But I don't know, I think Joe Wicks, and there are others as well, that have been very highly influential, and the types of exercise that you can do in the gym without equipment, you can use your body weight to do, for example. So people have cited that actually, although they might miss those activities, they did find other ways to exercise by doing online classes or cycling more or walking more. So although you might not get the same kind of exercise regime that you would have done before in the gym, so for example lifting weights, there are other alternatives that can be done, and I think overall people did find ways. And I think what was particularly significant was that limitation in being able to go out earlier on. And I think people who could go out that weren't shielding or self-isolating did. And I think that they made the most of that. Does that answer your question?
Yes, thank you for your answer.
Okay.
Just what I was thinking about also was that if walking brings me walking over this threshold of moderate intensity, which is required that any activity is beneficial for my health, or is it below that threshold?
I think that depends. So for somebody who's perhaps not so physical before, then any kind of walk would be beneficial. And I just think just even by being outside can help mental well-being. So people who are used to exercising more could perhaps walk faster. And certainly in the area that I live in, where it's quite hilly here, you could throw a few hills in, and that would increase your heart rate. So I think there's things that could be done, and whether people actually necessarily thought of that, I don't know. I would have thought that people who are used to exercising and exercised quite frequently before lockdown would probably find ways, inventive ways of increasing their heart rate.
Thank you.
So maybe as opposed to not walking, they could perhaps instead go jogging or running.
Many thanks. Are there any other questions for Ursula? There's a question by Peggy. Peggy, you can ask your question.
Yes. I'm always looking for the right button. I had a methodological question. Since you used mixed methods, you had a survey and also interviews. But I also saw that you reported quite some percentages. So I was slightly confused. Are you more interested in telling the story by numbers and percentages? And if so, I mean, as you said yourself, you don't really have a representative sample because, for example, you have a lot of females in your survey. Or are you just interested in describing your sample? And also with the interview quotes, I saw there were a lot of females that you quoted. So I'm just curious, do you try to get the sample more representative, or is that not your main goal? And are you mainly interested in the mechanisms why people exercise regularly in lockdown or not?
Okay, well, a bit of both, really. My intention was really just to open this up to everybody who would access the survey. And once I've done so now I've done some initial analysis. Yeah, I can see that I would like to increase response rates for certain groups. So that's really going to be the next stage that I will focus on, is to try and increase that. But you know, I'm planning to do interviews as well. So I will be using factual information gathered from the questionnaire. So because that's a bit more large scale than interviews, and then using the interviews to gather in more in-depth information, because I'm interested in how people felt during lockdown and what they did to try and combat that, and whether physical exercise helped them with that. So yeah, so I want to increase the response rate anyway, and then and I would like to increase responses from other countries, as well as from other ethnic groups as well. Not overly concerned about the male-female divide, because there's enough it's mentioned many times in the literature on research methods that that women are more likely to respond to questionnaires than males. I'm happy to be proven wrong. So yeah.
Okay, many thanks for your question and answer. Is there any other questions? I don't see. It's also given time we have to move to the other presentation. So I would like to thank you for your very nice contribution. And we'll move on to the next speaker. So I will change your role back to attendee. And I will promote Michael to panelist. Hello, Michael.
Okay, hello. Can you hear me?
I can hear you perfect. So you can share your screen with us if you have a PowerPoint or PDF.
Okay, can you see the slide?
Yes, we can see the slides.
That's great.
You can start.
And good afternoon to everybody who's listening. My name is Mutz. I'm a professor for sociology of sport at the University of Gießen in Germany, and my talk is about sporting behaviors, quite similar to the first talk that we heard. And I'm also interested in how people adapted and changed their sporting behaviors and sporting routines during the COVID-19 pandemic, and how these adaptations affected their well-being, and particularly their emotional well-being. As a starting point, I would like to give you some context information on Germany and on the COVID-19 pandemic in Germany. As in many other European countries, the German government put some containment and mitigation measures in force in late March 2020. Particularly on the 22nd of March, There were school closings, the social distance rules of 1.5 meters in public places, contact restrictions. Germans were not allowed to meet with more than one other person except household members. And most importantly for this talk, there was a lockdown of non-essential infrastructure, which included almost all sport and leisure infrastructure, sports clubs, fitness centers, but also playgrounds for children, public swimming pools, etc. And this situation lasted for 6 to 8 weeks. And in late May, early June 2020, there was a partial reopening of infrastructure, also of sports infrastructure, usually under strict conditions, that there is a hygiene concept and that all people who participate in a certain activity are documented so that contacts can be traced afterwards. But it's quite difficult to say when the reopening started in Germany, because all the 16 German federal states had a little bit different rules regarding this. My second starting point is on the sports infrastructure in Germany. There are 90,000 sports clubs in the country, and in the German Olympic Sports Confederation counts 27.5 million memberships. I looked at the latest wave of the Eurobarometer on sport and physical activity, and these data show that Germany is the country in the European Union with the second highest share of sports club members. So it's quite popular to practice sport in the setting of a sports club. And additionally, there are 11.7 million members in fitness centers, and there is an extensive public and private sports infrastructure besides these facilities, including swimming pools, climbing halls, dance studios, etc. So the lockdown of this infrastructure prevented millions from following their usual sporting routines. So people had to change their behavior, they had to adapt to the new situation. And this is one of the research questions that I'm interested in. First, what is the change at the population level? And then also the individual reactions to the restrictions. So how many people started new activities or omitted their usual activities or intensified their sports practice. And when we know these reactions, then we can also try to figure out how these adaptations relate to well-being. And here we focus on emotional well-being. And in this talk today, I will particularly look at the quantitative change of sporting activity and see if this is a predictor of subjective well-being during the pandemic or during the beginning of the pandemic. Of course, there is a lot of research already existing on the relationship between well-being and sport, exercise, and physical activity. There are some theoretical rationales, theoretical mechanisms, for instance, that sport helps to satisfy basic psychological needs, for instance, relatedness, mastery experiences, autonomy, flow, or self-expression. There is a very popular notion in sociology, a classic idea of Elias and Dunning, who argue that leisure provides excitement in unexciting societies, and with unexciting societies, they refer to the domain of work and the professional life, which is, according to Elias and Dunning, characterized by routines and monotony. There are other theoretical perspectives, for instance, cognitive recovery, that sports helps us to distract from any kind of strain or pressure. And also there are physiological reactions in the body when we practice sport, an increased production of endocannabinoids, adrenaline, and endorphin, which all are usually related to positive emotional states. These relationships have been shown in a variety of studies and also in reviews using a broad range of methods. So this is what we already know. What we do not know so good is how people, when they change their physical activity and sport behavior, how this affects their well-being. There is only a very small body of research, usually using experimental designs on exercise withdrawal, where volunteers are inactive for 1 week. People who are usually practicing sport are forced to be inactive for 1 week. And these experiments show that this leads to negative mood states, reduced life satisfaction, depressive symptoms, poor sleep quality, only after 1 week. The good news is that when these people start to be active again, their mental health is getting better again. And there is a second line of research which is relevant, I think, and this is on autonomy. Autonomy, or satisfying the need for autonomy, is a predictor of well-being. This has been shown at the individual level, but also at the country level, where countries which are high in autonomy values, or that in more affluent countries, autonomy is a stronger predictor of well-being. And the restrictions during the lockdown can be understood as a deprivation of autonomy, and people are constrained in their choices of practicing sport or where to practice sport. So I also look at people who stated that they feel forced by external constraints to change their behavior. And this may have an impact on well-being additional to the impact of exercise withdrawal. With these considerations in mind, I will shortly present a conceptual framework introducing, in the end, 5 groups that can be analyzed. First, we have the inactive population who never does any sort of sport, and then we have the active population. When we then look at the population who's active in sports and exercise, they can react differently when the lockdown started. They can reduce their sports activities, they can try to maintain their sports activity or even intensify their sports activities. And those people who reduce their sports activity can do this because of external constraints, because the gym or the fitness center, the sports club is closed, and then this is, I understand this as an external constraint that forces me to stop this activity. And there may be other people who were, I don't know, running, jogging, and they could also reduce their sports activity during the lockdown, but then this is more based on their own choice. That's more a voluntary decision. So these are the 5 groups that I will look upon on the next slides. The inactive population, those who intensified sports activity, those who maintained their activity level, and the 2 groups who reduced their activity level. And the colors that I have used on this slide is an indication of what the hypothesis is, that intensification of sports activity could be related to improved well-being during the pandemic, and both groups of reducers, and particularly those who were forced to reduce their activity level, are likely to have a decline in well-being levels. The data that I use are representative data collected in cooperation with Forza This is a public polling organization in Germany. They provide timely and high quality data. And we used computer-assisted web interviewing, so it was an online survey. However, all participants in the survey were recruited offline, so there is no online bias in this sample, which is, I think, very important. The sample represents the German population. We decided to start with 14 years of age, so youth and adults are included in the sample. And we collected data from 1,001 respondents. The data collection took place in the last week of March and in the first week of April, which is the second and the third week after the lockdown. So the data that we have shows the situation at the beginning of the lockdown. And we had a focus on physical activity and well-being in this mini survey. Sports activities were measured with the question, how much time did you play sport or exercise in your leisure time? And we asked this question twice. First, respondents should refer to the last week. So this was a week when the measures to contain the spread of the coronavirus were already in force. And we asked this question for a second time, where respondents should think of a normal week before these measures were put in force. And we also had an open-ended question afterwards, where we asked people to explain a little bit more deeply what they changed in their sporting behavior. What did they modify? What did they leave out? What probably did they try to begin again? And in this question, many people wrote statements that we can use to distinguish those who reduced their behaviors because of external constraints, because they wrote, my fitness club is closed now, I can't do anything, my sports group is no longer meeting, the facilities are closed, and stuff like that. So we can use these answers to figure out which respondents changed their behavior because of external constraints. And we concentrated then on emotional well-being. We asked respondents how they felt in the last week. They felt happy, enjoyed life, felt vital, felt well-balanced, sad, lonely, tired, and worried. So we had positive and negative emotions. And we also were interested how these emotions changed since the beginning of the containment measures. And afterward, we analyzed the positive emotions and the negative emotions separately, but in this presentation, in the end, I will only concentrate on effect balance. So the measure which resembles the difference of positive and negative emotions. The higher the score of effective balance, the more positive emotions people have in relation to negative emotions. Let us first look at the sports activities during the lockdown. You can see in this figure the share of people who were inactive and who practiced less than 1 hour, 1 hour, 2 hours, 3 to 4 hours, up to more than 6 hours of sport. And here you can see the change to a normal week. And it is obvious that in those groups, 2 hours of sports per week and more, there is a decline. In some, it's 18%. It's a decline of 18%, and there is an increase in the group of the inactive people of 20%. So in general, the collective level of sports activity in Germany declined during the lockdown. That's not really a big surprise. When we look at individual reactions, we can see that that the largest relative share of people remained inactive. They were inactive before the pandemic and they remained inactive during the pandemic. This group is 36%. Then we have the reducers who completely stopped practicing sport or considerably reduced their level of sports activities. This group is 31%. There are other people who maintained their activities, 27%, and a small group of intensifiers. These are people who started sporting activities or increased their level of sports activity. And then we can use the open-ended question to figure out if reducers were forced to reduce their activities because of external constraints, or if they did this voluntarily. And then we see that 13% were, which we label, were forced to reduce their activities, and 18% did this voluntarily. When we look at the emotions at the beginning of the lockdown, we generally can see that people, when they compare their emotional states with the time before the lockdown, they report that they have less frequently positive emotions, and only a minority of 8 to 15% report that they have more positive emotions than before. And it's the other way around with negative emotions. 29 to 58% of people report that they have more negative emotions at the beginning of the lockdown, and particularly it is anxiety, where people report that they feel and experience anxiety more often than before. So the overall level of well-being is decreasing at the beginning of the lockdown. But the most important question was, how do these changes in sport and exercise activity relate to well-being at the beginning of the lockdown? And first we look at the effect balance at the beginning of the lockdown, and then at the change measure, where people compared their current situation, their current condition with the time before the lockdown. And when we look at effect balance at the beginning of the lockdown, we see that those who involuntarily reduced their sports activities reported the least positive effect balance, whereas those who intensified their sporting activities reported the most positive effect balance. The reference group are those who were inactive before and during the pandemic. So this is a reference group, and involuntary reducing sports activity is detrimental to effect balance. And when we look at the change measure, we see that both groups of reducers reported that their effect balance has become worse in comparison to the time before the lockdown, but the effect size is almost is much more pronounced in the group who reduced their activities involuntarily. So it's an additional effect that if you feel or if you perceive that you are deprived of your autonomy to make free choices, then this has an additional negative effect on positive and negative emotions. And also we see that intensifying sport and exercise during the lockdown has a positive effect in comparison to the time before the lockdown. So these are, I think, the most important results. Additionally, we see when we look at the demographic variables that there is a negative effect for gender, which means that females reported more negative effect balance at the beginning of the lockdown, and also felt that their well-being level decreased steeper than those of men, which could be the case because of the childcare obligations, school closings, maybe greater job insecurities that women felt in comparison to men. In conclusion, or I can try to summarize the most important findings and their implications, We see that there are massive adaptations of sports activity during the lockdown with regard to the quantity, but also, and I left this out in this presentation, with regard to the settings and the types of activities. So even the people who maintained their activity level often changed the types of activities. They started with outdoor endurance sports or with home-based exercises, workouts, etc. Secondly, we see that reducing sports activities is associated with a steeper decline in subjective well-being than remaining inactive. So it means that if you, especially if these reductions are forced by external constraints, this means that you take something away from people which they value and which they usually like very much, and this has an additional negative effect on their well-being level. And on the other way around, we see that intensification of physical activity has a positive effect on well-being during the pandemic. So I think we could conclude that sports activity helps people to cope with pandemic-related frustration, boredom, other sorts of negative states and negative emotions that are related to these measures. As I said, the pandemic may have increased gender inequalities. With regard to well-being, it did not increase gender inequality with regard to physical activities. So we compared the groups of reducers, maintainers, and intensifiers, and we see that both genders are represented equally in all of these groups. What I think is needed is research from later stages of the pandemic to see how quickly people retain maybe to their initial subjective well-being level, but also to see in the long run how they adapt their sporting activities, particularly when they started individualized home-based activities. Do they really keep these activities, or is the scheduled organized form of doing sports in a sports club or in a fitness center something which helps people to remain active over a longer period of time, to practice something continuously and constantly? Okay, here are some references, and then I would thank you for listening. If you are interested in the adaptations of sporting activities, not in the well-being section, but only in the adaptation of sporting activities, there is a paper in the International Review for the Sociology of Sport on that. And if you have any comments, you can write to my email and I will be happy to answer all questions. Thank you very much.
Thank you, Michael. There is still some room for questions. I see here hand by Peter. Peter, you can ask your question. His hand disappeared. So probably he pushed the button by accident. Would you like to ask a question, Peter?
Sorry, that was. I enjoyed the presentation, but I don't have. It's not my main field, so I'm interested to look at and see a different spaces, but I can't. I have no direct question now.
Okay, no problem at all. Any other questions from the attendees? Peggy, I will.
Okay. I had a question, and I think at the last slide you partly gave the answer to it. I was wondering, because your focus obviously is a lot on the frequency, so whether people have changed their level of activity, but how would people have to calculate, for example, if they indeed change their types of sport activities? For example, I changed from physical offline dancing to online yoga and offline roller skating, but how would I know if I intensify or maybe stay the same? Was it easy for people to calculate that in the survey? And the other comment was more that the finding that you had on that the reducers had a higher drop in subjective well-being than the inactive sporters. That really matches nicely with the loss aversion theory. Probably you're well known with it, but that came to my mind when I heard your talk about it.
Okay, sorry, which theory did you mention? I didn't hear it correctly.
The loss aversion theory.
Okay.
So people really hate it when they have to give in, for example, in terms of money. If there's a drop in income, that hurts more than when people gain some income.
Yes, that's exactly what we expected in advance. That reducing something which you like and which you really enjoy leads to some kind of frustration, and that this kind of frustration will have an impact on your well-being level, of course. The first question is really interesting, but I think it's hard to test all these assumptions. I'm pretty sure that people can correctly estimate the hours that they spend with sport in 1 week, because usually sport has a clear beginning and a clear ending. It's not like with physical activity, which includes walking and cycling, where you really can have problems to remember it correctly, how much time you spend in a week with these activities. I think with sport, people can remember the time correctly. But of course, your question is very interesting. Does it change the well-being level when I change from activity A to activity B? And if this was your question, then we try to figure out what people changed, and they wrote a lot in the space that was provided for these open-ended question. But then you realize that the world of sport is so diverse, and it's really hard to make up any kind of groups which then can be compared in a quantitative analysis. That's really difficult. And in this paper in International Review for Sociology of Sport, we tried to do this and reported what people started new and what they omitted and what the reasons were. But I think it's really difficult because the world of sport is so manifold.
Yeah, the element that I discovered was that, yeah, just it was more in terms of novelty or reintroducing old things. I mean, I did roller skating as a kid and now I started doing it again after 20 years. So that definitely had an impact on my subjective well-being. So I can imagine that the novelty that happens when you change your sport activity, that could also have an independent effect. But yeah, not an expert.
Yeah. Yeah, it's a very interesting suggestion. I'm not sure if we can manage this with the data that we have. What we had in mind and what we can do is that we are able to assess when people change the domain of activity, let's say from sports to gardening. That's something that we can assess with the data we have, and we didn't analyze these data, but I'm pretty sure that gardening doesn't provide the same satisfaction like doing sports. That's my guess. But within the field of sports, I think we do not have data which allows us to do it on that precise level that you mentioned. But it would be worthwhile anyway.
We have another question by Daniela, and I will give the floor to her.
Okay, can you hear me?
Yes.
Perfect. Thank you for the presentation. I have three different small details, and one is inspired about your discussion with the previous question, and I will start by that one. Related to changes and especially having measurements, I was thinking that in some categories of sports, like running, the runners already have some kind of devices and they like to keep statistics. And I'm only curious if you try to collect data about this, because you could see how much they run before and after. That is one question to you, if you could collect this kind of more objective data from the runners, for example, one category. Second, it's mostly to the analysis, and it's only based on your slides. I saw very clear that in model specification, at least the one what you display for us, you show age as being only with linear estimation, and I will suggest you to try some polynomial, at least quadratic, given the differences and especially related to changes. That might help. And why I react on that, because in your conclusion, you make conclusion about these gender inequalities, and you I'm not questioning your results. I believe that they are good, and they say something what perhaps many people expected. But I react from another perspective, because are some kind of age inequalities before and after. And into that perspective, I was thinking that maybe you might, especially into this context with coronavirus, you might pay a little bit more attention to age aspects. Thank you.
Mm-hmm. Okay, thank you for sharing your thoughts. I think they are very valuable. The first question is easy to answer. No, we don't have any kind of objective data on the distances that people are running or on the steps that they are making. We only have the survey data, so subjective data. The age effect, yes, it is interesting, and we have analyzed the data according to age groups. And we found, for instance, that older people are overrepresented in the group of reducers, and many older people wrote in the open-ended question that they have fears to go out because they feel more vulnerable to the virus than younger people. So age is of relevance, of course. As far as I remember it now, we do not find any age differences with regard to well-being measures. So that's why I left it out in this presentation. But it is relevant when it comes to the changes of sporting behaviors.
Okay, thank you.
Okay, thank you. I think if I look also at, there are no more hands or questions in the chat. Oh, there's a question by Ming Chai. So this is the last question before we move to the other.
Thank you, Michael. It's a very interesting presentation. I just like to know that if you compare the sports with the other kind of leisure time that you use during the pandemic, for example, if you play more games, well, does it also, you know, has that kind of effect, like you have more sports that help you to improve your well-being. I'm asking this is that sports and game belong to a big concept of leisure or hobby. So does sports are more important than the other leisure activities in your study? Do you have any information or research finding to share with? Thank you.
Thank you very much. This is a very interesting question, and I wish we had more data on other leisure activities, but we do not have these data. We were very much focused on physical activities, and we tried to measure physical activity in different domains, in work-related domains, in transport-related domains, in the domain of leisure when it comes to sports and lighter activities, but we do not have data on other leisure activities, for instance, going to the cinema or listening to music or things like that. And so I can't say anything about that, but of course I would hypothesize that when people are deprived of other leisure activities which they enjoy and which they find valuable, then it should have also detrimental consequences for their well-being levels. But that's only a speculation now.
Okay, thank you for all your questions. There is still a remark of Peter Kraus in the chat box. So going back to sports and gardening, his impression is that in big cities, gardening was essential in the period of lockdown, not in terms of sport, but at least as being able to get out. So
yeah. Shall I comment on this?
Yeah, we can comment very briefly, and then we.
Okay, very quickly. When we analyze our data on gardening, we see that it does not relate so much to positively to well-being as sport. So there is a very small effect, and I think that there are also a lot of people who usually don't like gardening.
Okay, many thanks for your presentation and contributions, and we move on to the next present. Hi, Peggy.
Hi.
Perfect. I can hear you.
But you probably can't see me. Wait. Yes.
Yes.
Okay, let's try whether the sharing works.
Yeah. Okay. Yeah, we can see your screen.
Yay.
Perfectly fine. So go ahead.
Wait, I'll put it on. Doesn't go to the. I got it. So, hello everyone. My name is Peggy Schyns, and I would like to present part of a report I've written together with some of my colleagues at the Netherlands Institute for Social Research. And it concerns the theme of COVID-19 lifestyle and mental health in the Netherlands. And just to say it beforehand, I'm not really an expert in the field. I just was participating in this report, and I had to make myself an expert in a very short time. So the outline of the presentation is I will really briefly tell you something about the background of the report series, because the report I've written that is one of 4 reports. Next, I will tell something about the report itself, which is on expected consequences. Wait, I have to minimize myself, otherwise I don't see the slides. On mental health, so the themes and the method that we use. And then I will present some results based on a selection within the report, which is on lifestyle and mental health. And then I'll finish off with some conclusion, discussion, and policy implications. Just to tell you briefly about the background, our institute, in Dutch it's called SCP. It's too complicated to explain how it gets to these abbreviations. But it's a rather new avenue for our institute, since what we have done in these reports is what I would call high pressure cooker research. The reason why I call it like that is because in general our institute does research for departments, for the government, and we, well, usually months, sometimes even years, we have the time to do research. Now, of course, it was different because of COVID-19. Our government wanted to know what the effects of COVID-19 was, not only for the physical health of people, but also the mental health of people. That's why they asked us to come with a report series. And for now, we have 4 different topics. And the first 3 that you see mentioned below, they have already been published. And the 4th one will be due at the end of August. But today I will focus on mental health. And the main research question of this report was what are the expected consequences of the COVID-19 and economic and the accompanying economic crisis, I should say, on mental health in the Netherlands. And I focus on lifestyle. We had other factors in the report, but I don't want to confuse you. So for today, I just focus on lifestyle. So the sub-research questions were, what is actually the mental health status and change in the Netherlands? Does lifestyle change due to COVID-19? And finally, what is the relationship between lifestyle and mental health? And our hypothesis was that we expect mental health in the Netherlands to change, since lifestyle factors, which are related to mental health, are changing because of COVID-19, either voluntarily or involuntarily. And well, lifestyle factors, even that is quite a broad domain of research, but we decided to select 3 factors that a Dutch institute which specializes in this type of research, they usually use. So that's physical activity / leisure sports, so it's more movement in general. Then something on diet. The 3rd one is substance use or abuse. It depends on how you look at it. And finally, we also decided to include sleep hygiene, since we read in the Dutch newspapers that people were struggling with sleep problems. And the methods, they're quite different from what we're used to do. Usually at our institute, we collect our own data from a random sample of the Dutch population. This time, we had to write these reports in 2 to 3 weeks, so we did not have time to gather our own data. So what we did, we collected a survey or registration data on mental health prior to COVID-19, and we did have data on that. And next, we scanned the national and international literature on reviews concerning those lifestyle factors and mental health. But we also studied the effects of earlier crises on mental health. And finally, to say something about mental health changes during lockdown, we reported something some results on Dutch flash surveys and articles in, for example, newspapers. But as I've written in the next word, with caution. We use it with caution because as an institute, we are not really allowed to publish percentages if they are based on non-random samples. And most flash surveys, they have not, well, they're not random samples. So we only give directions of change instead of saying X% has changed. So firstly, I will start with the dependent variable, which is mental health and the level and the development pre-COVID-19. So in our most recent figures are from 2018, and approximately 12% of the Dutch population has a low score on the mental health inventory 5. I don't know if you're all familiar with it. I'm not an expert in it, but it's 5 questions concerning how you have felt the last 4 weeks in terms of nervousness, feeling down, calm, depressed, or happy. And especially certain groups have low scores, which are the lower educated in the Netherlands, people with low income, and non-Western migrants. But also, if you look at the decline in mental health, we did see a decline among, for example, men, 18 to 64-year-olds, the lower and middle educated, and people with low income. And these results are based on random samples, so we actually can generalize this to the Dutch population. 65-year-olds and older apparently have remained quite stable in their mental health in the past 10 years. And then some effects that we found in the literature studies of earlier crises and the effects on mental health. So we can think, of course, of the Spanish flu, which was in 1918. That's quite a long time ago, more than 100 years by now. SARS, which is more recent, and several economic crises. And the thing that struck us was that it's really suicide related. In all those major crises, you could see that the suicides increased. For example, in the United States, in Norway, but also in the UK, you saw an increase in mental health registration during the Spanish flu of 1918. And if you look at economic crisis, in addition to an increase in suicides, especially since 2007, we see that in the Netherlands there has been a drop in suicides, but since 2007 it has been increasing again. In addition to that, there's also a more positive finding that, for example, there's a decrease in depressive feelings in the European Union between 2006 and 2014. So yeah, it's not all, well, in a way it's bad news, but it's not all bad news. And then the third result on mental health changes, these are the changes we witnessed during the COVID-19 crisis. We have one result from our own study, which is based on a random sample. And more than half of the Dutch population says that they worry a lot about COVID-19. And this was collected in April of this year, whereas 5% has no worries at all. Would be interesting to know who those people are who don't have any worries. Based on non-random samples, as I said before, I will not give any percentages here because they only give some kind of direction. But well, it's quite obvious that the majority worries more and the minority experiences more anxiety, stress, gloominess, There's lower average happiness reported, and also, interestingly enough, small minorities experience less stress and more happiness. And I think I belong to one of those aberrations, that during lockdown I experienced less stress and more happiness. And for specific groups, it is found that especially people with poor health and low income experience more stress and anxiety, young people and disabled people, respectively, more stress and more anxiety. So these are all results on the dependent variable level label. So prior to COVID-19, we had robust figures, and these are slightly less reliable because they're not based on random samples. So then the second relationship, the one between COVID-19 changes and lifestyle changes. Again, we did not have any reliable results yet, only non-random surveys. But as we said, we saw hints at change in lifestyle. And I'm pretty happy to hear that other presenters spot the same direction of change. So that even though they're not random surveys, at least they point in the right direction. What we see in physical activity, that was one of the factors of lifestyle, is that there's less physical activity, and quite alarmingly, especially among the very young, so between 4 and 12 years old, their physical activity level has, in the beginning of the lockdown, dropped dramatically. Then the second factor of lifestyle, diet. Here we see a slightly different development, that the majority has remained relatively stable in their diet, and I should say a healthy diet, and according to them, because that was up in the eye of the beholder whether they had a healthy diet or not. But some reported that they ate less healthy, whereas others reported they ate more healthy than before COVID-19. And sleep hygiene, again, just a flash survey, but a minority reports having sleeping problems. And then finally, with regards to COVID-19 and lifestyle factor, the fourth factor, which is substance abuse. Drugs, apparently there's a possible increase in cannabis use, but they also estimate that because of a decrease in festival and cafe visits, there should also be a drop in the use, because those are the instances where in a way it's more like a social activity. So if that just doesn't follow through, people use it less. Interestingly enough, they did some sewage measurements in 3 cities in the Netherlands, but that did not show an increase in drug use at home. So with drug use, it seems not to be alarmingly different. With alcohol, I found a new flash survey from this August, and the vast majority of Dutch people reported the same consumption of alcohol. And again, small minorities drink more, respectively less. With regards to smoking, also a new flash survey from August. Minority smokes more, but more robust data are registration data. There's a sale increase of cigarettes of 10% during the crisis. So people definitely have, well, at least they bought more cigarettes. Then the last relationship, the relationship between lifestyle and mental health. Here we had to base ourselves on the literature, and what we found, and I also heard it from other presenters, between physical activity and mental health, there's a positive relationship, For example, higher self-esteem, better emotion regulation, lower anxiety and depressive feelings. However, some studies can't necessarily prove causality. So it's a relationship, but it's not always obvious whether an increase in physical activity will affect mental health. The same holds more or less for diets. There's definitely a positive relationship in the literature between high quality diet and mental health. But again, causality is not undisputed, and there are not many RCTs or experiments in this field. However, if you look at sleep hygiene, the causal effects on mental health are undisputed. For example, insomnia causes not only lower cognitive skills, but also depressions. It heightens the chance of suicidal thoughts and even suicidal behavior. And finally, substance abuse. Here are negative relationships. Sometimes we find causal effects. And regarding towards alcohol, in this sense, I would say abuse, there's definitely a causal effect on mental health. The WHO listed a whole list of things you can get from alcohol abuse, such as psychotic episodes, depression, dementia, anxiety disorder, and suicide. So that's pretty well documented. So to conclude, what can we learn from our, what I would call the high pressure cooker research we did on possible consequences of COVID-19 on mental health? The first observation we had is that representative and reliable empirical data are still lacking at this moment. So it's still hard to assess a COVID-related lifestyle change, which in turn affects mental health. Saying that, for us, it was also difficult to do a quick and dirty research in this regard, because you had to rely on the available other studies. So a generalizability towards the Dutch population is an issue at the moment. We can't say a change in lifestyle factor X has this effect on mental health. It's just not possible. The other thing is that the relationship between lifestyle factors and mental health is quite complex and not always causally clear-cut. So, as I said before, in the literature, it's not easy to say that this will lead to that. And moreover, in the literature on lifestyle changes, we learn that it's very difficult to change lifestyles. I mean, this is a natural experiment in a way with COVID-19. But we know that the Dutch population is still drinking a lot of alcohol, is still eating a lot of meat, is still not exercising regularly. And this has been the case for many years. So it is difficult to change lifestyles. But even that if we assume that you could change the lifestyle in a sustainable way, then the next question would be, when and among whom can we expect alarming mental health changes due to these lifestyle changes? A third question that we had is, how can we use this study as a, what I would call a red flag waving device towards policymakers? As I said before, 3 out of the 4 reports have been published, but our report did not receive a lot of press attention. you never know, of course, whether it's been picked up by departments or the government, but it's difficult. We found it difficult to get the information across. And the last question, that's nearly, I would say, a moral question. I'm struggling with it, and colleagues are struggling with it as well. Should we, as an institute as we are, carry out these short-term reports? Because they're new to us, we have to rely on other people's literature and empirical data, and what is the impact on policymakers? And those are my well, that was my presentation. Thank you for listening. If you have any questions or remarks, there's my email address, and I finish off with an overview of my city.
Beautiful picture.
Yeah, I know. Rotterdam is so beautiful.
Well, in 2 years' time, we can all experience, hopefully.
Yeah, oh, I forgot. Yeah, of course. Then you can see how beautiful the city is.
Okay. Many thanks for your presentation, Peggy. Are there any questions for Peggy? There are 2 questions. I'll start with Kelsey, and then we move to Urszula. Kelsey.
Yes, first I'd like to say that I find Rotterdam to be quite pretty. So there's much more water there than where there is next to me. So I appreciate it very much. And then, my question is, you mentioned that you're focusing just on lifestyle in this presentation, but maybe you can give us a hint as to the other things that you cover. I'm thinking more about economic factors, but also, use of communication technology or heterogeneity by age, relationship status. So I'm wondering, what else did you guys cover? Thank you.
Well, do you mean with regards to mental health or other effects on other factors? Because we did both.
Okay, yeah, sure. So I'm thinking other determinants or factors contributing to mental health.
Okay, we also had to make a selection because we only had literally 2 weeks to write it down. So we selected what people could write on, and the only other 2 topics that we covered was loneliness, so the social network of people, and the other one was job security and job loss.
Okay.
But those 2 topics were written by other colleagues of mine.
Okay, great. I want to add then just one thing. So for the next time you write this, there's a group out of the UK, What Works Wellbeing, and they have a Google document for well-being evidence that it's crowdsourced on COVID-19. And so it's really similar to what you're trying to do, but then they're trying to borrow from everyone. So it may be of interest. And what I'll do is I'll post it here if you want to follow up.
Yeah, sure. Very much would like to.
Cool, thank you. And Martijn, I'm finished. Thanks.
Hi, Peggy, can you hear me?
Yes, I can hear you.
Okay, great. Yeah, I really enjoyed that. Thank you. And just to say that I have also been to Rotterdam and I find it very beautiful. Shame we're not there right now. Okay. Yeah, so my question is, can you explain what you meant by flash survey? I'm not familiar with that term. I may know it by another name. And also how exactly you use these. Thank you.
Yeah, maybe I wasn't completely clear what I meant by it. What we meant by it is non-random samples. So surveys that were online and people could just apply, there's a term for it if you apply yourself for a survey. So what we usually do at our institute is that we have a sample drawn from the population in the Netherlands. So it's a random sample, and you know that every person has the same chance to be in there than other people. But with the non-random samples or the flash surveys, we just can't use the percentages because they're not reliable. If, for example, 60% or 70% is women who have completed a survey, it's tricky to say in terms of percentages that X% of women do this or that. So that's why at my institute there's quite a high scientific standard. We started off by writing and using the percentages, and we said it's based on non-random samples, but it all got rewritten. It had to be rewritten because we're not allowed to publish that, because our experience is that the media will immediately pick up on percentages and then they're not based on random samples. Sorry, did you have a second question? I forgot if you did.
Oh, I think you answered that. It was kind of like how you used them. So
Okay.
am I right in thinking that these were just perhaps quick surveys that were put online and then whoever accessed them at that time would answer it, hence being more of a opportunity sample or something like that?
Yeah, it's more pragmatic.
Yeah.
They didn't have the time to do a random sample. If we do a random sample, we have to go to another institute who is in charge of random sampling, and it takes weeks, if not months, before you can get. So that's why, that's why they do other. I don't know exactly of all of them how they do the sampling, but it's most of them literally write down. It's not a random sample, so please be careful with using the percentages. Yeah.
Right. Okay. Thank you. Thank you.
Okay. Thank you. Let me see whether there are no other questions I see. So then, Peggy, I would like to thank you for your very nice contribution.
You're welcome.
Yeah. And hope you enjoy the rest of the conference. It was also the last presentation. As I mentioned in the beginning, Lina Martínez was unfortunately not able to present. So that means that we have a break now. I should mention that you're still able to see the last presentation of the other session that is currently going on. So if you're interested, you can always pop in there. Also, they'll make sure that you use the new Zoom link there. And for those who prefer a break, I hope to see you back